After surgery, you may have some weight-bearing restrictions from your surgeon. This is a very important thing to know going into your surgery and after your surgery to make sure you follow the protocol. Some options for weight-bearing that we'll talk through might be weight-bearing as tolerated, meaning you're allowed to put as much weight as you tolerably can through the affected leg after surgery. You may be non-weight bearing, meaning you can't put any weight through that leg. It needs to stay floating in the air off the ground to maintain that non-weight bearing status. And you may also be partial weight bearing. This has a lot of gray area in it where you may be given a percentage of your body weight that you can put through the leg, or you may be given toe touch weight bearing, where you can use a little bit of support for balance, but not putting much weight through the leg. The next videos will talk you through some examples of moving with each of those restrictions with crutches. Again, it's very, very important that you have a very clear understanding of what your restrictions are after your specific surgery. This video shows weight bearing as tolerated, offloading through those crutches to support the surgical limb as it moves forward. This is non-weight bearing, so no weight goes through that surgical limb and the crutches help balance and support. And finally, we have partial weight bearing. This shows maybe a little bit more than toe touch, getting a little bit of weight through that leg, mostly using it for balance, and the crutches are taking the majority of the weight to help offload.